Hello, I'm Dr. Mike. Just like people, dogs can rupture their cruciate ligament. This ligament plays a very important role in stabilizing the knee. When injured, it can be very painful and will likely require surgical correction. To learn more, we will listen to Dr. Brian Beale, a board-certified veterinary surgeon.
Well, a cruciate ligament is really probably the most important stabilizer of the dog knee. It really is what keeps the knee stable. Every time the dog walks on his leg, this cruciate ligament is holding the two bones in the proper alignment. So if it starts to tear, basically what happens is the dog's knee is starting to shift, and every time the dog takes a step, the knee shifts in an inappropriate direction, and this can lead to arthritis down the line and a lot of pain. The dog ligament tends to wear out over time. So essentially, the ligament has a partial tear to begin with, and then it slowly tears over time until it eventually completely ruptures. Now, so what is the cause? Well, it's probably multifactorial, but it's actually a degenerative process that occurs. Different types of things that can cause a cruciate to rupture in the dog. Part of it has to do with breed, the conformation of the dog. In other words, do they have very straight legs, or do they have more bent leg posture? Part of it has to do with just genetics, and then also a lot of it has to do with the actual anatomy. And if you look at the top of the dog's bone, on what we call the shin bone or the tibia, if it has a very sloped top to it, these dogs are probably going to have much more stress on their cruciate ligament, and this may contribute to them tearing their ligament. There's other factors that can also contribute. Certainly if a dog is a real hard charging dog and running around real hard, they may increase the force in their ligament. Another way to increase force in the ligament is if they're carrying too much weight. So if they're overweight, that's going to increase the likelihood that they can tear their ligament. Other things, if they have other metabolic problems, there's a disease called Cushing's disease or diabetes. Those type of problems will also weaken that ligament and make it more likely to tear. There's actually different types of cruciate tears. There are dogs that have partial cruciate tears, and these are the tough ones. These are the dogs that we really want to diagnose, because if we can catch it early, we can prevent a lot of the arthritis that we see. The other type of tear that we see is a complete cruciate tear. And again, a lot of the dogs that have complete cruciate tears already have arthritis. So the goal is to diagnose it early, because then our treatment is going to be much more effective. The clinical signs of cruciate disease can vary. It can vary from something as mild as not wanting to jump into the car and kind of sitting off to the side, to being obviously lame and carrying the leg. And as an owner, what you should notice is a difference in what your dog's willing to do. Again, are they willing to go out and play, or do they seem like they're getting old and just kind of sitting around? All of these things can actually be clinical signs of a ruptured cranial cruciate ligament. If you suspect your dog has clinical signs of a tear of the cruciate ligament, the first step is to contact your veterinarian, because they're going to be the ones who can look at your pet and diagnose it very quickly, and it really is a fairly easy diagnosis to make. They're probably going to want to just do a simple physical examination, and then they might want to take a radiograph to make the diagnosis. So once a cruciate ligament tear is diagnosed, then we have to look at the different options for treatment. And there's medical options and there's surgical options. Now, as far as the medical options, what we want to try to do is treat for pain, and so we can do that with different medications. Then we also want to try to keep the joint as healthy as possible, and there's a lot of different supplements that we can use to help treat the joint and keep it healthy. Lastly, what we want to try to do if we're not going to do surgery is try to get the muscles as strong as possible, because that can help protect the knee as well. And so this would involve different physical therapy or rehabilitation exercises. Surgical treatment of cranial cruciate ligament disease is an optimal way to treat the patient. And the reason is that the knee is unstable, and any medicine that we give is not going to stabilize the knee. What we would like to do is actually get the knee to be stable, so every time the dog takes a step, the knee is no longer shifting inappropriately.
Cruciate rupture in the dog is a very common injury. If you notice your dog limping on a hind leg, you should bring it to the attention of your veterinarian. He or she can determine if it is a cruciate injury and the best treatment options available. I hope that this video is helpful, and thanks for watching.